Hello and welcome to this presentation of the N95 filtering face piece respirators and their use within the COVID-19 environment. My name is Corey Dunphy and I will be your presenter today. I'm currently a Health Standards Officer with the North Carolina Department of Labor, OSHA Division in the Education, Training, and Technical Assistance Bureau. At the end of this presentation, I will provide you with my contact information in case you have any additional questions you wish to ask. At this time, we will go ahead and get started on the presentation. So as many of you guys know, we are currently in a kind of an interesting time in life, having to deal with this COVID-19 virus and how are we supposed to protect ourselves. Well, hopefully today this presentation will give you a little bit more clarity on the role of the filtering face piece in protection and also what OSHA's guidelines are, standards are, as far as their usage. Our objectives today, we're going to start off with talking a little bit more about COVID-19. What is it? What are some of the symptoms? We're going to talk about how to protect yourselves, both employees and general public. So what are some of those methods? One of those methods, and getting a lot of publicity nowadays, is the use of a face mask or a respirator. So we're going to talk a little bit about the differences between a surgical mask and a N95 filtering face piece respirator. What are those differences? What makes them different? What are the different features? Stuff like that. And then we'll finish off today talking about some applicable OSHA standards when it comes to dealing with respirator usage and also in this environment of COVID-19. So, what exactly is COVID-19? I'm sure you guys have heard many different titles for it. You've got COVID-19, you've got the Wuhan coronavirus, the novel coronavirus, a lot of different names for it. So basically, what is it? So it is a respiratory virus that spreads easily between humans, very similar to common cold. With its makeup, it's a viral infection. Also common to a couple of other issues we've had in recent memory, which was SARS and MERS. The difference is right now between SARS and MERS is pretty much the ability of it to be transmitted between other folks. It's very, very easily transmitted between humans, and that's kind of what's making this one a little bit more of an issue, because it is so easily transmitted. So why do you hear the differences between COVID-19 and coronavirus? So like we said, the term coronavirus is really a description of the virus that really affects the respiratory system. Okay, corona, the prefix, indicates crown-like spikes on the surface of the virus. So if you're looking at it under a high-powered microscope, you'll see that little virus, and it'll have the little crown-like spikes, which on a lot of newscasts and everything, you'll see that depicted. Novel basically means new. So novel coronavirus is the new coronavirus. When you hear people refer to COVID-19, basically what that stands for, the CO stands for the corona, VI is virus, the D is disease, and 19 is basically indicates that it was basically discovered in 2019. So when they say COVID-19, they're talking about the disease that is caused by the coronavirus. And this name is given to it by the World Health Organization, who is pretty much the leaders when it comes to keeping track of things like this, epidemics, pandemics, different viruses that are occurring across the world. And currently, per the World Health Organization, COVID-19 is at a pandemic status. It means we've got a lot of cases going on throughout the world, and it's not really affecting just one area, it's affecting pretty much the entire world. So it's one of these that everybody needs to be aware of, and everybody should be doing stuff to take care of. What are some of the symptoms of COVID-19? How do you know when you have it? Now, unfortunately, not everybody is going to show the same symptoms. You can have any of these symptoms: fever, cough, sore throat, runny nose, tiredness, shortness of breath, nausea, and loss of sense of smell. You can have many of them, any of them, all of them, and also to differing degrees. And why you have different degrees depends on how healthy you are and also your body's immune system. Now, I want to point out one thing. If you look at these symptoms, fever, cough, sore throat, runny nose, tiredness, shortness of breath, nausea, they all sound like a lot of other illnesses, like the flu. So what makes this different? You really can't tell. If you start feeling like you're getting flu-like symptoms or feeling like you're coming down with the flu, that's when they say you need to really be tested. You need to go out and get yourself checked, because the only way to tell if it's the flu or the coronavirus is to get that test done and to be able to determine which one it is. Now, a lot of people are now noticing this loss of sense of smell, which may be an indicator that you do have COVID-19 rather than the flu. If you start feeling like you're not as sensitized with your sense of smell as you have been in the past, that may be an indicator. But like I said, not all of these symptoms occur in everybody, so you may get it, you may not. Another issue with COVID-19 is that these symptoms can show themselves anywhere from 2 to 14 days after the exposure. The most common time frame for showing symptoms is 2 to 5 days after exposure, but they can go up to 14 days. That's one reason why a lot of the experts out there are recommending the 2-week quarantine window or self-isolation window. So if you have it, you give yourself that 14 days to show symptoms before you go back out and get out of quarantine or self-isolation. Also, one of the issues we're seeing now is those symptoms can show themselves anywhere from 2 to 14 days after exposure. Well, what are you supposed to be doing before you show symptoms after you've been exposed? So you don't know that you were exposed, and you can go up to 2 to 5 days, 2 to 14 days before you really show that you're exposed with symptoms. So that's one of the issues that a lot of the public is dealing with right now. Is you have people who are exposed are not showing symptoms, also known as being asymptomatic. So they're asymptomatic, but they still have the virus. So now we're trying to get those people under control, and that's one of the reasons why a lot of states around here, and including North Carolina, have issued the stay-at-home order, trying to keep people out of the public settings in their houses, kind of self-isolating on a mandatory level to prevent those unknown transmissions of the virus. As an employee and as a member of the public, what can you do? What's recommended to help protect you against catching COVID-19? Avoid touching your face, especially your eyes, nose, and mouth. These are places on your body that viruses can easily enter the body, so that's why you want to stay away from them. Practice physical distancing. Some people will call it social distancing, making sure you're at least 6 feet separated between other people in the public when you have to go out. Right now in North Carolina, the guidance is that you only go out when absolutely necessary for food or medical attention or medical supplies or necessities. You don't go out just to kind of hang out and have fun with your friends, stuff like that. But if you do have to go out, make sure you're practicing that physical or social distancing. If you know of somebody who is ill, you want to make sure you try to avoid contact with that person. Sometimes that is hard to do, especially if you're their caretaker. So if you're their caretaker, we'll talk in a little bit about some of the other precautions you can take. But for the general public, if you find out somebody is ill, you want to really give them their space, try and give them the room so they can self-isolate themselves, keep themselves away from everybody else, and hopefully get through the COVID-19. CDC, or the Centers for Disease Control and Prevention, and NIOSH, which is the National Institute of Occupational Safety and Health, are really some of the forerunners here in the United States as far as guidance to protect employees and the general public from the coronavirus. Right now, you want to make sure you check in their guidance on social gatherings, work schedules, stay at home. Like I said, right now, here in the state of North Carolina, they have mandate no gathering people more than 10 people at any time. Work schedules are working at home if possible. Otherwise, non-essential jobs are not being completed at this time. They're all being told to work and stay at home. So that's what we have here in the state of North Carolina right now. By the time you hear this, things may have changed. So you want to make sure you're keeping track of what the current guidance is. Something else that you can do to help protect yourself, especially if you do have to go out into the public, is what we call universal precautions. Make sure when you can, you wash your hands frequently with soap and water for at least 20 seconds. Now, 20 seconds, people say you want to make sure you sing happy birthday twice or something like that. It's the way I view it, it's kind of hard actually to get that regulated because, what do you do when you get excited? You sing, you talk faster, you sing faster. So it's kind of hard to regulate it. So what I want to do for you right now is I'm actually going to pause and let 20 seconds run off so you kind of get an idea of how long 20 seconds actually is. Okay? So at this point, I'm going to go ahead and take that pause, and I'll be back with you in 20 seconds. All right, I'm back. That was 20 seconds. How many people feel that that's how long they're washing their hands? And we're talking about scrubbing their hands for 20 seconds, not running them under the water for 20 seconds. Okay? All right, so we said you want to try and wash your hands frequently if possible. If you are unable to, you can use hand sanitizer to cleanse your hands, but you do not want to trust the hand sanitizer as a substitution for the hand washing. It's just a temporary guard to help minimize the transmission. But as soon as you can, even if you're using the hand sanitizer, you still want to try and wash your hands frequently with soap and water. If you feel like you need to sneeze or cough, which this time of year a lot of people are feeling the effects of pollen, allergies are starting to kick up, so they may be sneezing or coughing out in public. If you feel like you need to make sure you try and cover your mouth and nose with a tissue. If you don't have a tissue, sneeze into the crux of your elbow, collar of your shirt, something so you're not spreading the droplets of moisture coming out of your breath. That's really where the virus is getting spread, is through those we call them respiratory droplets. So you want to try and keep them from being spread. If you've been out in public and you come back and you touch surfaces like to put your groceries down or whatever, you want to make sure you're cleaning and disinfecting those surfaces frequently. There are several products out there that are recommended. Department of Environmental Quality, DEQ, here in North Carolina, or Federal Environmental Protection Agency, EPA. Both have lists of approved sanitizers that can be used. If you do not have access to these approved sanitizers, they do say that you can use diluted bleach solution, which would basically be 5 tablespoons of bleach per gallon of water. That should be adequate to be able to clean and disinfect the surfaces around the house and stuff like that. Also, if you do have to go out in public, especially if you're going to be dealing with somebody who is ill, the use of PPE, or personal protective equipment, is also recommended. Now, what PPE is going to be recommended for healthcare providers or people who are having to come in direct contact with people who are directly infected or infected, such as if you're caring for a loved one who is infected with COVID-19 or something like that. What are they recommending for? Gloves. They're talking about the use of some nitrile gloves to kind of help prevent the contact with any contaminated surfaces. Gowns to protect your body and your exposed areas of your skin that may be able to keep any respiratory droplets off your body, away from you. Eye protection, same thing. Face shield, same thing. You're trying to keep those respiratory droplets away from your eyes, mouth, and nose. And then they also talk about using a respirator, which is an N95 or greater, or surgical mask. Now, you'll hear us talking about N95 respirators, surgical masks, homemade masks, stuff like that. There are some differences, which we're going to talk about a little bit later, but just keep in mind for now that those respirators, the N95 or greater respirators, are really going to be a lot better barrier, more protection for the person wearing the respirator than just a simple surgical mask, just because of the way it's designed, the way it's built, the way it is constructed, and what it is designed to do. So we'll talk, like I said, we'll talk about those a little bit later, what those differences are. But if you don't have access to an N95 or greater respirator, we do have some alternatives, surgical masks. They're talking about homemade masks, stuff like that. But you want to try and have something on there, if especially on your covering your mouth and nose if you are in the healthcare provider realm. If you are not in the healthcare providing realm, what should you be doing? Okay. Now keep in mind, these are going to be in addition to those recommendations from earlier as far as the social distancing, the hand washing, stuff like that, following the stay-at-home guidelines or whatever's in effect at this time. If you are infected with COVID-19 or you think you may be, I definitely want to be wearing an N95 respirator or surgical mask if you have to leave and you're unable to quarantine or self-isolate. The design of those respirators and masks are really going to be, for you, if you're infected, really going to help prevent you from spreading the disease, because anytime you're going to have those respiratory droplets, whether it's a sneeze or a cough, or even just normal breathing, it's really going to keep those the virus from escaping into the atmosphere for other people to contract it. Right now, as of Saturday, April 4th, the CDC is recommending that all members of the public wear something over their mouth and nose when you have to go out in the public, such as like going to the grocery store or something like that. This is more so to kind of tackle it from both sides. One, we talked about earlier, the symptoms of COVID-19 don't show up or can not show up for 2 to 14 days after you've been exposed. So you're walking around, you're asymptomatic, but you have the virus. Now CDC is recommending you wear something to protect other people from contracting it from you. So that's where they're talking about the homemade mask or cotton face covering. They're also recommending it for people who are not infected because it will give you another line of barrier, a line of defense, a barrier from breathing in the respiratory droplets that are infected from other people. So that's kind of where the CDC is coming from. Now, keep in mind, the CDC and OSHA are going to be two different entities. They're not going to be giving the same guidance all the time. They do take into account each other. OSHA is going to be a lot slower to react than CDC will. Okay, part of that is because the CDC is really designed and really focused on protecting the public, the average person walking through the street. OSHA is designed for protecting employees. So we're looking at, the employees, the workers that are out there doing construction jobs or in the grocery stores or in the healthcare setting, stuff like that. So that's why you're going to see some difference in our guidance and guidelines and standards, whatever, as far as respiratory protection use and things like that. One thing that you will see with the latest CDC guidance is they are not recommending that members of the public wear N95 respirators. Reason being for that is they would rather the people who are dealing with them the infected people on a regular basis, like the healthcare workers or somebody who's caring for somebody who is sick and infected, leave that higher protective equipment for them. So the average general member of the general public doesn't need to have the N95s. Just the homemade face mask or cotton face covering should suffice, in their opinion, for what they're trying to recommend the purpose. But they really want to leave those N95s for the healthcare professionals. All right, so you've heard us talking about the surgical masks and respirators. What are some differences between the two of them? Surgical mask. Okay, this is what you see when you go to the doctor's office, or you have surgery and you see the doctors putting on these the surgical masks. They're really loose fitting. There's no real tight seal around the face. These are also tested and approved through the FDA, Food and Drug Administration. But the main intent of them is to be able to protect the wearer against large droplets or splashes of bodily fluids, hence the term surgical mask. Not really designed to filter out smaller airborne particles like anything that's been aerosolized or anything like that. So it's not as protective as the N95, but it does protect against the large, like I said, the large particles. Discard after each patient because they're going to be designed to be single use. Really not a way to tell if it is contaminated or not. And if it is contaminated, then it's one way that it could transmit to other people is if you keep wearing the same respirator over and over. The same face mask over and over. So generally speaking, they're talking about you want to discard it after every patient. Due to the current conditions and current shortages of face masks and respirator, CDC has come out with guidelines about how you can do what we call extended use or decontamination reuse, which OSHA really does not agree with the reuse portion of it. But as far as the extended use, OSHA has come out with guidelines to kind of follow the CDC's guidance on the extended use. You see this last bullet here, it says usually not considered respiratory protection. So from an OSHA standpoint, we normally would not consider a surgical mask to be respiratory protection because it's loose fitting, no way to really get a good seal around the face with it. Our standard says that our respirators, in order to be considered a respirator, have to be tested and certified by NIOSH, which is the National Institute of Occupational Safety and Health. You can see these surgical masks are approved through the FDA, not NIOSH. So there are several things that, through the design, construction of the face masks, the surgical masks, that kind of prevent it from being considered a respirator. But in this environment, this day and age, CDC is recognizing these as respiratory protection against the novel coronavirus. So, like I said, usually it's not, but right now CDC is kind of viewing them as respiratory protection. What makes up an N95 filtering face piece respirator? Okay, by definition, OSHA says that a filtering face piece respirator is a negative pressure particulate respirator with entire or majority of the face piece composed of a filtering medium. So basically it's that filter that you're going to be breathing through, and as the contaminants in the air come in and try and come through that filter, they're going to get trapped, preventing them from going into your lungs. So that's kind of the design of them. What makes them different from surgical masks? They're going to be tight fitting, so they're going to have they're going to be tighter around the face, going to come a lot closer contact around the mouth. You're not going to see the openings on the sides like you would with the surgical mask. Typically, in order to achieve that tight fit, your N95s are going to have two straps, one that goes over your head around by the crown, coming across the crown, and then one that's going to be coming down lower underneath the ears around the back of your neck, where if you look at the surgical masks, they're only going to loop around the ears, stuff like that. You may see an N95 filtering face piece with an exhalation valve, which would be a little valve kind of typically going to be right there in the middle of the mask. Doesn't have to be, because like I said, the whole mask is your filter when you come to the N95. When NIOSH is testing these respirators, what they're looking at is they're looking at the ability of the respirator to prevent and filter out particles that are 0.3 microns or larger. So micron, it's a microscopic measurement, a lot smaller than those large droplets that the surgical masks are designed to prevent. So therefore, these are going to give you a lot higher level of protection than the surgical mask. That's kind of why NIOSH is looking at them, they're certifying. Now, what does that N95 classification mean? Basically, when NIOSH looks at these, they look at the ability of the filter to keep out particles. So the 95 represents a face mask that, when tested, was able to keep out 95% of the particles 0.3 microns or larger. You may see some face masks out there with the numbers 99 or 100. Once again, now those are going to be a higher level of protection because they're filtering out more of those particles. 99 is 99%. 100 is typically they're going to say 99.7 or 99.8%, but instead of saying 99.8, they say 100 because it's very close to 100. Now the N portion of it means that it is not designed to be resistant to oils. Okay, it's for particles. It's not for gases, vapors, stuff like that. Okay, so that's where that N is for. You may see a P or an R in front of the numbers when it comes to an NIOSH rated filtering face piece, and basically those are just, okay, you have some that are partially resistant to oils and some that are more, or as they claim it, as strongly resistant to oils. Okay, so that's what the letters mean and what the numbers mean. But really, that's kind of, when you see those, the number and the letter designation, that's going to come from NIOSH. When you're wearing the N95 filtering face piece respirators, just like your surgical masks, they really normally should be discarded after the initial use. This current conditions, you really have a shortage of these N95 respirators, so CDC has come out with guidelines as far as how to be able to extend the use of filtering face pieces. Typically, what these guidances are gearing towards are more, okay, keep, if you can, just keep it on. Look for signs of contamination or breakthrough, or if it gets damaged in any way, then go ahead and change it out. Don't keep using something that's broken. CDC has also come out with guidelines for decontamination and reuse of filtering face piece respirators. Like I said, OSHA really doesn't believe too much in the decontamination and reuse unless it is something where that reuse is going to be for the same individual. And then once again, they've got guidance as far as checking to make sure that it hasn't been contaminated, is still in good condition. It has been stored in a Ziploc bag or something away from the contaminants, so you're not going to get infected or get any contaminants on the inside of the mask where you're trying to breathe. Okay. FDA, or pardon me, the CDC realizes that there are limitations as far as the number of N95 filtering face pieces that are available. There are short supply. Currently, there are other countries such as Brazil, Australia, Japan, Mexico, Korea that are that are manufacturing these respirators, but they're not being tested by NIOSH. They're being tested by entities within those own countries. So NIOSH and CDC have come out with guidelines as far as using them if possible. On the slide here, you kind of see the hierarchy of how the recommendations right now are from the CDC. And as of this past Monday, OSHA has agreed to kind of follow those same guidelines as far as allowing the use of respirators from other countries, as long as the employer is still practicing a good faith effort to protect the employees. Making sure they're still doing all the training and the testing and the fit testing, seal checks, etc., so forth. Making sure that those employees know how to utilize the respirators properly. So even though they're not certified by NIOSH, they are still able to be used. So just going to go down this kind of hierarchy list. If you don't have an N95 filtering face piece respirator available, first thing you want to try and look for is to see if you can get one that's a higher protection rating. So N99 or P95, all those would be something that would provide you a higher level of protection. Perfectly acceptable. Tight-fitting elastomeric respirators with cartridges, like HEPA or N95 filter, or supplied air from a clean air source. These are the kind of a lot of people, when they think about respirators, these are the ones you see. They can either be half mask, they could be a full face mask, they could be more the hood with the hose coming out of it, stuff like that. But those are going to be a higher level of protection than the filtering face piece. So those would be acceptable. If none of those are available, but you now can get a N95 type respirator, a filtering face piece respirator that is certified from another country, such as, like I said, Australia, Japan, Brazil, Korea, those would be the next line. Once again, if you notice on the slide, it says those are approved by the FDA or CDC, not by OSHA for use in the US. Okay. One thing you want to keep in mind, there are a lot of respirators that are coming to us from China with a KN designation instead of the N designation. Based on testing, those respirators are not performing at the same standards as respirators from other parts of the world, like Australia, Brazil, and European Union, stuff like that. So when it comes to recommended usage, CDC and FDA, NIOSH recommend using ones from those countries where the testing, they're meeting similar standards to what NIOSH would be, only using the KN95s and stuff like that if you don't have access to the other ones. And then lastly, CDC, once again, not OSHA, is recommending the use of homemade face masks or cloth masks as a last resort if no other options are available for protecting yourself from COVID-19 or the coronavirus. Okay. If you are looking at using respirators in the workplace to protect your employees from other contaminants such as silica or a chemical that they're working with, this does not apply. Okay, OSHA still is looking for those qualifications that are available in the respiratory protection standard as far as evaluating the workplace, making sure that you have the appropriate respiratory protection, stuff like that. These guidelines right here are only for the current conditions when you're dealing with coronavirus. Okay? So we now have kind of what the coronavirus is, a little bit about the filtering face pieces versus surgical masks and stuff like that. Now we're going to step back and kind of look at it from an OSHA standpoint. You have employees who are still working. If they're considered to be an essential employee, they're still on the job, and they may be exposed to COVID-19. What are some of the standards that are going to apply? What are some OSHA standards that would apply to your job, your business at that point? So we're going to start off and look at the record keeping standard, which is the 1904 standards. This is the one that requires the recording of any injuries and illnesses that occur in the workplace based on a workplace exposure. So right now, COVID-19, if one of your employees contracts COVID-19 while in the workplace or suspected in the workplace, it is considered to be a recordable incident. So you want to make sure you're recording that on your OSHA 300 logs. If you are unsure but you feel there is the potential for the employee to have contracted it at the workplace, you still need to record it. The only time you would not record it is if you know that that exposure or that employee contracted it outside of the work environment, so it would not be work related. Now we're getting into our personal protective equipment standards, the 1910, 132, 33, 34, 38, stuff like that. So see here we got the 1910, 132 general requirements. This is where it is the requirement of the employer to evaluate the hazards present at their work site or in their business and determine how they're going to protect their employees from those hazards. Now keep in mind, when you're doing that hazard evaluation, there is the hierarchy of protection that you want to keep in mind. If you can eliminate the hazard, can't eliminate it, see if you can substitute components to make it a safer activity. If you can't eliminate it, then try and put in machine guarding, engineering controls, stuff like that. You can't engineer it out. Now you're going to look at administrative controls. Can you kind of do a job rotation to help prevent your employees from being overexposed, stuff like that. If none of those are working, the use of personal protective equipment should be the last line of defense. So that's the last thing that you would be looking at. But sometimes that is the case, that you do require personal protective equipment. So the employer would have to make that evaluation and document what the evaluation is and what PPE they're requiring people to use. 1910-133 is our eye and face protection standard. So if you go look back at that, when we talked about the PPE in the healthcare setting, talked about using the face shield and safety glasses as a line of defense or barrier for the employees to prevent them from getting the respiratory droplets to their eyes and mouth and nose. This is kind of where that's kind of can be looked at, is in this standard. So making sure that if they have those hazards, that they're being protected. Respiratory protection, this is where we've been talking about with the N95 filtering face pieces. We're going to go into that in a little bit more detail in just a minute. So I'm going to hold off on talking about that at this point and just move over. But like I said, we will touch base with it in a couple slides. Hand protection, this is the use of gloves, 1910-138. So you want to make sure that your employees are using gloves if they're going to be coming into potential contact with contaminated surfaces or something like that. So they need to know how, make sure that you got the right gloves for the task, and that the employees know how to take them on and take them off, stuff like that, so that they're not contaminating the rest of their body. Sanitation, our 1910-141 standard. This is where it's going to come into the responsibility of the employer to make sure that they're keeping the work environment clean. You're doing your due diligence to wipe stuff down, keep it clean, prevent the virus from spreading due to environmental contact with surfaces, stuff like that. 1910-1020, which is our access to employee exposure and medical records. This standard is in there because anytime you have an employee tested or medically evaluated or something along those lines, the employee has the right to see what the results of their tests are. Not everybody else's tests, but their tests. So you have to make sure that you give them access to their file as far as what the results of those tests were, or if they were part of a sampling protocol, what the results of their monitoring was. 1910-1030, which is our bloodborne pathogen program, is something you kind of need to be aware of because part of your bloodborne pathogen exposure control plan talks about deals with infection control, utilizing universal precautions, utilizing the extra personal protective equipment to prevent the spread of diseases. Typically, bloodborne diseases, which COVID-19 can be transmitted via the blood. It's not the most common route, but it still can be transmitted that way. So you want to make sure you're keeping an eye on that, and also following the universal precautions that are outlined in that standard. 1910-1200, which is our hazard communication standard. This is the one where you have providing the information to the employees about any potential chemicals or anything that they're working with in the workplace, so they know what it is they're working with, how they can protect themselves, stuff like that. This could be key because now you have people using sanitizers, cleaners, and stuff like that. They need to know what they're working with. Excuse me. So they need to make sure they know what they're working with. Is it hazardous? What they need to do to protect themselves, stuff like that. And then the last standard we have is going to be our General Duty Clause, which here in the state of North Carolina is the North Carolina General Statute 95-129, paragraph 1. Basically, what the General Duty Clause states is that it is the duty of the employer to provide a workplace for the employees that is free of any known or recognized hazards. So while we don't have anything specific in our standards that talks about coronavirus, like I said, we have all these other ones that kind of feel around the edges and stuff. We don't have anything specific, but we do have that general duty clause. And at this point in time, that coronavirus would be considered a known hazard. So it is the duty of the employer to make sure that they're doing everything they can to protect their employees. So if OSHA does an inspection and determines that they're not doing everything that they should be doing, then the general duty clause could come into play at that point. All right. So we talked a little bit earlier, last slide, about the respiratory protection standard. So here we're going to get into a little bit more detail because really there's two types of respirator use in the work environment, whether it is required or whether it's voluntary. Each of them is going to have a little bit different guidelines as what needs to take place prior to allowing the use of respirators in your facility. So we're going to start off looking at if the hazard assessment requires the use of respiratory protection to protect the employees from something. First thing you got to do is you got to develop a written respiratory protection program. On our website, which is www.labor.nc.gov, we have a sample respiratory protection program out there that you can use as kind of a guidelines. And within that program, you really need to have kind of outlined how are you going to protect your employees. First thing they got to do is they got to have a medical evaluation or clearance. What's your procedure going to be for getting that done? fit testing, training, maintenance, care, and cleaning of the respirators. How are you going to teach them how to do it? Who's going to be in charge of maintaining this program and ensuring that people are following the guidelines of it, stuff like that. I mentioned the medical evaluation. We do have in our standards, it's one of the appendices in the back of our 1910-134 standards, which will give you a template for kind of a questionnaire that your employees can answer. There are other templates out there, but basically what this is going to do is going to give them kind of a quick evaluation, answer yes, no type of deal of their respiratory health, and to determine whether they are physically fit and able to wear a respirator safely. Now, once that questionnaire or evaluation is completed, it needs to be evaluated by a medical professional or a licensed healthcare professional, not the employer. Difference being that the majority of your employers are not medically trained to be able to determine somebody's fitness as far as their respiratory health and stuff like that. So you really need to go to somebody who is the expert on that. So you want to make sure that they're being evaluated properly. Fit testing, you want to make sure that whatever respirator is determined that is required to be worn fits the individual. Okay, there are in Appendix A of our standard, we have a couple of testing protocols out there, qualitative and a quantitative, that you need to follow one or the other to determine, make sure that the respirator fits the employee, and if it doesn't, you may need to get them a different respirator, that different size or different brand, something like that, that will fit their face better. Training, maintenance, care, cleaning, proper use, basically just how to use, how to put the respirator on, take it off, which is called donning and doffing. How to do those properly, how to take care of your respirator, when to, if it's a filtering face piece, when do you know that it needs to be changed out? When is it overloaded, stuff like that. Same thing with your cartridges if you're using the elastomeric respirators. Last thing, it says program evaluation. This program is something you really have to kind of keep an eye on and annually do a check on it, make sure it's still up to date and that everything is still working on it, and just make sure that it's signed off on every year, that everything is still good. So that's really what you're looking at as far as if you have a work environment where the use of respiratory protection is required. Now, what if it is not required? What do you have to do? This is where we get into what we call our voluntary use of respirators. First thing that the employer has to do is, when they're doing that hazard assessment, they have to determine, make sure that if they allow somebody to use a respirator, it will not create an additional hazard to the employee. You don't want to do something that's going to make things worse. So that's first and foremost. If you got to allow them to wear it, that they're going to be okay. Next thing you see on the slide says medical evaluation clearance. So if you're going to be requiring employees to use those elastomeric respirators, they've got to be medically checked out. Same questionnaire that you're using in the required portion of the program will be here. Training on maintenance, care, cleaning, proper use. You got to teach them how to use it. You can't just say, hey, yeah, you're on your own, hop to it type of deal. And then the last thing it says is information from Appendix D. Now, this is kind of an important appendix for this voluntary use, because basically what it does is it gives the employees some information saying, hey, if I'm going to let you wear this, you need to make sure you're following the manufacturer's guidelines as far as how to wear it, stuff, how to figure out the limitations of it, stuff like that. Also kind of gives them a heads up that there may be some additional stress put on the respiratory system of the employee, and that it also, states that it is a voluntary use thing. While it is not required it is a good idea to get your employees to somehow sign off that they have received this information as far as the Appendix D. Whether it is give them a hard copy and you sign off on it, date it, get it back from them and put it in their file, send them an email, have them electronically sign it, something like that. But really, it's a good idea to keep that information so if there's any question, you can show that they have been provided with this information. Now, you'll see on there the medical evaluation and the training section have asterisks beside them. That's because per our standard, if you are only looking at filtering face piece respirators and allowing them for voluntary use, then really the only things you really need to do are going to be the determination about the additional hazard and the Appendix D information. You don't have to go through those other things because with the following of the manufacturer's guidelines, that's where they're really going to get a lot of that training that is required. So that's kind of what you're looking at. A prime example in a normal business situation where you may allow voluntary use of an N95 respirator or something like that would be if you have somebody who is one of their auxiliary tasks is to sweep up. Potential for having some dust generated in the air. They feel more comfortable having something on their face, a respirator or protection to keep them from breathing in all that dust. In current conditions, this will be where you're kind of looking at as far as the employer goes. Are you going to require your employees to wear a respirator during the job to keep them safe from N95? Or are you going, from coronavirus? Or are you going to allow them the opportunity to wear a respirator? That's where your determination as the employer has to come in. So you really want to look at your situation, look at your work environment, make that decision. Now, if you remember back earlier in the presentation, we talked about face masks and surgical masks and stuff like that are not considered respirators by OSHA, but are recommended by CDC, NIOSH, stuff like that. The use of those face masks, the homemade masks, stuff like that, would not fall under the respiratory protection standard from OSHA. So they kind of are really covered from this. So you want to keep that in mind as you're looking at it, because if you're going to allow them to wear the homemade masks but not the N95s, now you're looking at, does the respiratory protection program even apply, which at that point probably would not. So just keep that in mind as you're going through and evaluating your work environment as far as what type of respiratory protection, if any, is needed. Now, to help you make that decision, we are offering you a couple of websites that could help give you some guidance. First and foremost, you see on there is the Center for Disease Control and Prevention. They're daily providing updates as to what's going on. As needs change and knowledge changes, they're updating what their guidance and their guidelines are. So you want to make sure you keep checking on those pretty regularly. See, next one on there is the Occupational Safety and Health Administration, or some people call it Federal OSHA. This is another good source of information, especially as a business owner, to kind of keep tabs on what's going on from the Federal OSHA standpoint. Now, right now, OSHA has issued 3 memos for exceptions to the respiratory protection standard when it comes to respiratory protection in the workplace. First one was specifically for healthcare individuals, talking about extended use of respirators. The extended use of respirators, stuff like that. We also have one out there that basically waives the requirement for the annual fit testing for healthcare workers. They still need to go through the initial fit testing and stuff like that, but healthcare workers, they still need to go through the initial fit testing and stuff like that, but the annual fit testing is waived, especially if they're doing N95s. And then the third one is the one that talks about the hierarchy of masks recommendation from the CDC if the N95s are not available, kind of giving that allowance in the workplace if those N95s are not available, but making sure that you're still following the good faith efforts to protect your employees, stuff like that. So right now, those are the only three that have come out. Could there be more by the time you hear this? Possibly. So you want to make sure you're keeping track of what's going on from the OSHA standpoint. OSHA has also developed a guidance publication, the guidance for preparing workplaces for COVID-19, which has a lot of good information in it, which is available for download on their website, and gave you a link to that document there as well. State of North Carolina, our OSHA entity is through the Department of Labor, and on our Department of Labor website, the labor.nc.gov, we do have some information about coronavirus and what you can do to protect yourself, stuff like that. So that's that website. And then the last website is the North Carolina Department of Health and Human Services. They're really the ones that are working with the governor as far as the North Carolina specific guidance, enacting the North Carolina stay-at-home mandates, stuff like that, coming through DHHS. So you want to keep track of what's going on their side as well. So today like I said, we talked about, what's going on, what is the COVID-19, what's coronavirus, and what are some of the symptoms. Focused a lot on how you could protect yourself and what are some of the differences between the respirators and face masks, stuff like that, and how OSHA looks at things. As I said before, if you have any questions, here's a number of the main number for the ETTA section, or you can call me directly. My number is 919-707-7859, and be more than willing and happy to help you kind of understand what's going on and talk to you about your particular situation if you have questions. So at this point, we're going to go ahead and close out this presentation. Thank you for listening, and hopefully you guys are staying safe. Have a good day.